The one thing that we know about the NHS, everybody who is sitting in this room, is that it has a very unique and particular place within the national psyche, within our minds, within our hearts, and has done for the last almost 65 years. And of a free service that is not based on your ability to pay, but is based on your need, is absolutely enshrined in those core principles. And of course that was the founding principles of the NHS, that it would be an accountable service whereby government was required to care for its citizens in need, and where care would be offered from the cradle to the grave. And this attack has its roots actually in that idea that there is something about the public sector, about public services, that we can simply no longer afford. Well, actually, let's not forget that the government has obligations to care for its citizens. The changes that are currently being proposed actually begin to break down that clear accountability. It's no accident, for example, that the funding comes down now to GPs. It's not the Secretary of State who will ultimately be accountable for the delivery of the NHS services. It will be your GPs. They don't have the experience of commissioning services. And so what will happen, and we've already started to see it, as pariah consultancy companies will start coming in, making little bids to be the commissioning to say, we'll do your commissioning for you, GP consortium, we'll do your commissioning, and we'll be making bids, or bloodsuckers, yes, the leeches and the parasites on the back. It is really significant, not just for the NHS, but actually for society. Because what the NHS as that employer has done is it's offered a career route for a whole range of people who 50, 60, 70 years ago could never have expected to enter into professional fields, to achieve their aspiration, to move beyond the mines, the pits, the docks, or wherever. It's actually brought a whole cohort of working class kids into professions. And more than that, it's provided professional routes and professional identities for predominantly women workers. What it's also done in that process is it's been an absolute beacon of organised labour. It's set the standards over things like health and safety, employment rights, because it's been based upon an acknowledgement that there has to be collaboration around the workforce issues and around staff as its central resource. And that doesn't just have an effect on the public sector. It sets the high tide mark, if you like, that private industry, that private organisations can also aspire to and negotiate towards. And if that gets fragmented, then it's not just the public sector that will suffer from that. It will be every group of workers in every industry that loses that benchmark of good collective bargaining practice. I think it's had one other really important impact as an institution as well, and that is around this idea of actually altruism. The idea that we do offer our service, our labour, if you like, to care for those who are in need. And that for many of us working within the organisation, that is the reward. That is the identifying principle. You know, I've always been proud to say I am a public sector worker. Now that, I think, right now is under threat as a direct result of what has been happening over the last decade to the health service. And that's what we see in terms of Mid-Staffordshire and the care, or the bankruptcy of care that was offered there. Now, why has that happened? I think that has actually happened as a direct consequence, not of bad training, not of recruiting the wrong people, but of actually a constant sapping of morale on the one hand, and more important than that, a major ideological shift which turns the patient into a commodity.
Yeah.
So we are no longer a human being here, we're a hip to be bid on. Or we're a cataract to be removed as cheaply as possible. And in that process, in that cultural process, is there any wonder that care and compassion get lost sight of? Not just in individual staff who are running around like blue-arsed flies with ever-reducing numbers, ever more pressure on beds, but also in the culture of the place. So what's happened is that senior management within the NHS, trust boards, executive management teams, finance, 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 in order to jump through the hoops that the Department of Health have set. And of course, that produces the tick box culture, and it produces the kind of culture that reduces need to cost. We know what happens when profit becomes the motivating factor for delivering a service. In the short term, it may be great, it may be highly cost effective. I'm sure there are massive health providers on the international market who will quite readily come in and undercut what it costs to deliver cataract operations. They will come in and they will undercut what it costs to deliver GP functions in surgery. So in the short term, it may be highly cost efficient. But what happens as a consequence of that process? They're not going to take the most complex cases because they're costly. And if they're not taking the most complex cases, what happens? Do they end up back in the rump of what is the NHS, or the NHS takes more and more of the costs and then looks more and more inefficient against the bright and shiny private sector? And so in the short term there might be quick bucks to be made, but in the long term what it does is it exposes the whole commissioning process to the madness of the market. And we only have to look at what's happening in the gas and electricity market at the moment, and the rigging behind the scenes and the price fixing, that we know that the market must not, cannot be trusted with our healthcare, with our lives. We are constantly, as clinicians, being told that we must rely on evidence-based practice. You know, everything that we do must be thoroughly evidenced. Where's the bloody evidence that says the market, in any way, shape or form, can deliver public health outcomes? It is our NHS, because it's more than just a public service. We are the public. It's not a service that is provided to us. It's something that actually we own. We have a democratic say in. It is our service.